opportunity to learn what is new in this field of cardiometabolic diseases. So our concept is for everyone.
We have received a tremendous response from all the faculties and delegates last time that gave us a lot of encouragement and motivation. We are going to have eminent speakers across the country.
I welcome you all again here to Chennai. The last edition was a phenomenal success. This year too, we promise to give you better than last time with more workshops, hands-on training. For the PGs will have their presentations and which will be part of the publications too.
We provide a platform. If you are a faculty, we provide an opportunity for networking. If you are a student, we provide an opportunity to present your thesis. If you are an industry member, we provide you a platform for networking with the faculties. If you are a physician who want to learn, we provide an opportunity to learn what is new in this field of cardiometabolic diseases. So our concept is for everyone.
Hello, Dr. Sharan. How are you?
Hi, sir.
Hi, how are you?
I'm fine, sir.
Yeah,
Tell
yeah.
me. Yeah.
We just wait for another couple of minutes.
Sure, sir. Sure, sir.
So then we'll start the
Session.
proceedings for the
Sure,
day.
sir. You conduct these sessions every year, sir.
Yeah, this Cardiometabolic Congress is happening for every year.
Okay.
And we conduct this the pre-conference webinar.
Okay.
Just to it's like a preamble kind of thing, trailer
Okay,
to
sir.
what we are going to do in during our annual conference.
Yes, sir.
Like so, I just went through your CV. What is that?
Yes, sir.
MOSC Medical College, Cochin. What is that?
It's Malangara Orthodox Syrian Church Medical College, sir. It's a medical college in Cochin.
Oh, fine.
Short form. Mhm.
Okay. So I think it's very interesting to see your CV.
Yes,
Oh,
thanks.
of course, the not only in technology,
Sir.
app developer. So you got any apps developed by you?
Yes, sir. Most of the apps were developed by me only, sir. But presently, with the nowadays, I'm taking too much AI sessions in a month, so I'm not getting much time to develop nowadays. Like I was completely into app development for the past 2 years.
Yeah. It's good to know, like because
So
like,
presently, I can find time to maintain the.
I'm always find myself jealous of you. people with medico with kind of technical knowledge. I'm not a technocrat or techno savvy, but I'm always jealous of these things. Sometimes it's so incapacitating, and I feel so embarrassing
Just
that
for
like
time pass, sir, since I'm
it
into.
doesn't come handy. Like I need to get some. The technical assistant from the technical team or someone. Sometimes it happens. I think you got trained in the Massachusetts. You got the best app award.
Yes, sir. Not trained, sir. They had a platform for app development. So every month they conduct a international competition on creating apps based on their platform. So that particular month I got the best app award.
Oh, fine. So that is quite interesting. Like, so some of the apps for the depression also you've done.
Yes, sir. So depression, diabetes, then cancer was there.
Yeah.
Then this MIT thing was for deaf rehabilitation.
Oh, fine. Yeah. So that's quite interesting.
Mhm.
And I'm happy to see you are the invited faculty for various prestigious institutions also. Like, so good to see. Good to know your profile. Yeah, quite interesting.
Thank you, sir.
That's interesting. Yeah.
Sir, you were working in SRMC, sir, in Chennai?
Yeah, I'm working as a head of the department in Department of Medicine,
Okay.
Stanley College. You know that, like,
Yes, sir.
yeah. So I think quite a few number have joined. Lograj.
25, yes, sir.
Yeah. So I think we can start in another 2 minutes.
Sure, sir.
Start. Okay. Yeah. Lograj.
Yes, sir, please.
Yes, sir.
Yeah. You invite Dr. K. Shanmugam. Shanmugam is in the attendees
Yes,
list.
sir. Invitation sent, sir.
Yeah, you just invite him to come to the panelist.
Yes, sir. I already give sent, sir. Invitation sent, sir.
Invite him. அது அந்த ஒரு அதான். Yeah. So I think sir is joining. I think he has joined. Sir, good evening, sir. Shanmugam, sir. Shanmugam, sir.
Good evening, everyone.
Yeah, good evening.
Yes.
Sharan, are you ready?
As Dr. Chandru said, most of us are not familiar with the AI.
Yes, sir. I'm ready.
Now the Google tells, anything you put it, the AI comes with a speaker, for 1 minute or so. I think we should learn more about the AI.
Yeah. So Dr. Shanmugam,
we can utilize for a better clinical assessment and management also.
Yeah. So Dr. Shanmugam is the most respected senior physician in our part of the country. He's our patron.
Not country.
So yes, I think we can start the thing. Sir,
Sure.
Shanmugam, sir, we can start it, sir. So good evening, ladies and gentlemen. It's my pleasure and privilege to invite you and welcome you to this the pre-conference webinar of 4th Cardiometabolic Congress, which is going to be held on 27th, 28th of this September at Hotel Hilton. Today we are going to listen to Dr. Sharan Basil, who is the Associate Professor of Community Medicine, MSc Medical College, Cochin, Kerala. He is going to talk about the ethical use of artificial intelligence in healthcare. As physicians, are we ready or not? So many times, like we doctors, we found sometimes difficult to embrace technology. Though we are qualified, skilled person, we found sometimes they're difficult to embrace technology. But of course, though AI was used in many disciplines, radiology and in oncology and other places, like already AI was there. But suddenly there is a spurt of after this COVID, the technology has gone for a boom. And after this boom, so we get get to know the more about the artificial intelligence. And in fact, everywhere, wherever we go, whether as OP patients or inpatients, the calculations and the mathematics and all these things, we do have AI-based or AI-derived clinical solutions. That's what we are looking at. And there are so many platforms also to provide and assist us to get to know about this AI-assisted learning. So for even for the difficult patients, when we put their prompt, we get a kind of a solution for the challenging cases as well. In this scenario, though we all talk about the artificial intelligence, but there are the certain other side of the artificial intelligence also, the safety, the data safety, and the app developer, and the kind of the reliability and the ethical issues involved in artificial intelligence. So to talk about this, we have an eminent person. I think he is a fit person, Dr. Sharan Basil, who have been involved in various app development also. I think he has received many awards, including the Best App Award for Community Rehabilitation from Massachusetts Institute of Technology in the United States. And he is been regarded and recognized as one of the best app developer and best app of the year award in several times. He's quite a bit, kind of a very enthusiastic gentleman with astute to the technology and app development, entrepreneur, and he is author also. He has authored many books and on technology, public health related books, and diabetes management, all these things. He has done that, and he has been a popular invited speaker and associate and collaborator for various institutions, including the AIMS, JIPMER, and the Aligarh Muslim University, Indian Public Health Associations, and Academy of Family Physicians of India, and so on. And it's very nice to have Dr. Sharan with us, and he definitely is going to throw more light on the subject, the artificial intelligence, how effectively, judiciously, prudently wisely we can use this artificial intelligence in our clinical practice. Over to Dr. Sharan.
Thank you, Chandrasekhar sir, for the detailed introduction. So let me share my screen. 1 minute. Is my screen visible, sir?
Yeah, now it's visible. Fine.
So when I was approached to take this session, I thought of taking this as a curtain raiser for the session. We were planning one more session in as an offline session in the form of a hands-on training. So this is somewhat like a curtain raiser of what all AI can do in case of a clinical practice of a doctor in his or her hospital or in his personal life. So instead of talking too much regarding the theory, I thought of having this presentation in the practical aspect, so that those who attend the session, they can, from tomorrow onward, they may be able to apply some of these in their daily lives. All right. So basically, when we talk about different AI tools, you might be hearing so many different types of AI tools. Now, regarding clinician specific AI tools, there are so many which are customized for our clinical purposes. They are called, you might be familiar with IBM Watson, which was very popular long back. Now it's been called Mirative AI. Then there is something called DeepScribe, Viz AI and all. Now the problem with these set of AI tools is that they are completely customized for doctors, but their price point is really high. So from a personal point of view, it might be very difficult to subscribe to all these tools. They are highly expensive, somewhere in the range of from say 10,000 to maybe 20 to 25,000 per month. So from a personal account, it might be very difficult to purchase, and usually they will be purchased by the institution and will be provided for all the doctors. All right. So from my personal experience, I feel like there are other sets of tools that you are so much familiar with, like ChatGPT. Then there is something called Gemini by Google, then Perplexity, Claude AI, Grok. All these tools are free to use, and all of these tools are also applicable for physicians. So rather than focusing on all those hi-fi AI tools which are highly expensive, I thought of focusing on the free ones which you can readily use from tonight, and you don't need to pay anything, and how you can apply all these tools in your daily practice. So that's the main idea behind today's session. Now, you all will be familiar with ChatGPT, right? So just like ChatGPT, there are many other tools. Now, the problem with these set of AI tools is that they are highly intelligent. Sometimes the IQ ranges up to 145 and 150, and they are 100% hardworking. They work for you 24 hours a day. Only problem is that they will occasionally lie. Okay, so you can consider them like your personal assistant or like an intern. But the thing is, like whenever you are depending them for certain certain scientific information, say you are asking regarding certain drugs or a treatment plan for certain patients, in between they might lie to you. Okay, so this amount of lying, I will tell you why exactly they are lying and how you can overcome that. Among the different AI tools, ChatGPT is the most notorious liar. And why it lies? Because it's the way it's being wired, or how it's being created. It's like when they created ChatGPT, what they had done is like they like went through all the websites available in the entire internet. Though that will comes to almost like billions of websites, grabbed all the information in these websites and stored into a central memory. And whenever you are asking ChatGPT regarding something, say what are the side effects of cotrimoxazole, anything in that sort. So ChatGPT will try to like retrieve that information from its central memory. Now the problem is like its central memory is too big and it's too vast, so that whenever it retrieves this information, there's a chance that it will retrieve some information from wrong places. So because of that, it might give you wrong values, like sometimes the names of person, certain findings of certain studies, or certain values of certain numbers, all those things, years, all those things might be wrong. But now the problem is they will tell you this information in a highly confident manner, so that you won't be realizing like which is accurate or which is wrong. Okay, so because of this, there's an interesting name that has been given to this lying process, and this is called AI hallucination. AI hallucination means AI is trying to tell you the right thing with so much confidence, but it doesn't know that it's telling you lies. Okay, and presently with ChatGPT, the hallucination can go up to 30%, sometimes 35%, and ChatGPT is trying to make it even better and better. Right, like last Saturday, it got a major update called GPT-5. In that, the hallucination has been reduced to below 10%. Again, the hallucination part is there. On the other end, there are certain AI tools which are 100% accurate without any hallucination. So why I included this slide, because I just want to tell you regarding this particular aspect, and never depend on tools like ChatGPT or Gemini for scientific information or those related to medicine. But there are tools like Perplexity which are 100% accurate, which we will be seeing later on, which you can readily use as an alternative for up-to-date or any such if you want to have some clinical decision making or want to know about which are the articles published on various aspects regarding one particular treatment protocol or regarding certain drugs, you can readily depend on AI tools like Perplexity, which will give you 100% accurate results with references. Okay. Now, the questions that you ask these tools, whether it can be ChatGPT, Grok, Gemini, Perplexity, or anything. So the questions that you ask, these questions are officially called prompts. Okay, prompt simply means the questions that you ask this AI tool. All right. Now, the way you ask these questions are really important. The quality of answers that you obtain from this AI tool, that depend upon how well your questions are structured. Okay, so the way of modifying your questions or prompts in such a way that every time you are getting excellent answers, and if you are creating in one particular manner, every time you will get excellent answers. Okay, so the way of creating such excellent prompts, now it has become a super specialization in engineering, and now after MTech, I think people are like we go for this MCH and also just like that, and DM just like that. Now the engineers, they are now going for fellowships in prompt engineering, and they are becoming some job titles called prompt engineers. Okay, so the main job of these people are trying to create prompts which creates excellent results regarding certain aspects. Okay, now when you hear such this thing, you will feel like this is too much into engineering thing. Actually, this is so simple. So I will explain how you create questions to all these AI tools in an easy manner, but in a particular way in which you will always get excellent answers. All right, so I will explain it based on a simple example. So say you are going to ChatGPT or Gemini or any AI tool, and you are asking this particular question, like how can I prepare for a marathon, right? So it will definitely give you an answer. But the answer will be a generalized answer, because ChatGPT doesn't know anything about you. It doesn't know your age, or whether you have any previous experience with running marathon, or how much is your capacity. All those things it doesn't know, right? So it will definitely give you a generalized answer, right? So instead of asking like this, you can ask in this way, like I have mentioned here. You can mention like, I'm a beginner runner. I have never run a marathon before, but I want to complete one in 6 months. Now, how can I prepare for a marathon? Right? Now, the difference in this second prompt is like, I'm telling more about myself to this AI tool. I'm telling like I'm a beginner person. So the answer that is given by this AI tool will be completely beginner friendly. And I'm also telling like I have 6 months to prepare for the marathon, right? So the answer it give me will be definitely like a 6 months schedule type answer, and it will, that particular schedule will be of increasing severity. Like for first months it will be completely beginner friendly, then gradually it increase severity and so on, right? So the point that I want to make clear is like, whenever you're asking anything to this AI tool regarding you, say, whatever that is related to your practice, ensure that you are giving as much as information as possible. Okay, you don't need to reveal your name, you don't need to reveal your age, institution, anything. You can mention like, I'm a doctor from Chennai, or I'm a physician from Chennai, then I'm working in a tertiary care center, then I want to do these things, these are my requirements. So be as specific as possible and explain as much as details as possible. Okay, so ChatGPT will understand these things, and based on that, it will give you excellent answers. All right, so always keep this in mind whenever you are asking anything to any of these AI tools. All right, now I want to introduce you to some interesting practical applications of AI tool in your daily clinical practice. All right, so the first one is how you can use AI in enhancing patient communication. Okay, so this will be really vital in certain situations, especially if you are dealing with a problem patient, or if the bystanders are agitated, or in such scenarios, say if you want to have excellent like you want some advices from AI on how you can tackle this or how you can explain this to a patient. Okay, so I will show you a sample, and then you will get an idea. Okay, so here is the scenario. So this is primarily for a surgeon or a gastroenterologist, but I will just show you how exactly it is. So scenarios like this. You are having a patient who is a 55-year-old patient, and who is a farmer, and he is having very limited education, and he doesn't know anything regarding like medical, like all the complex medical terms and everything. He's, maybe you can consider like an illiterate farmer. Then he is diagnosed with early stomach cancer, and we are planning to like give surgery and chemotherapy for the patient. Okay, now we want to explain like we want to do the bad news breaking to the patient in a simple and compassionate language. Okay, so what we need to do is we need to go to this AI tool, whether it can be ChatGPT or Gemini or Perplexity, and give a prompt like this. So the prompt is explain to a 55-year-old patient who is a farmer with limited education, who has this. We'll explain what are the clinical situations of the patient and explain it in a simple and compassionate language, and we should be reassuring. Okay, so that's a prompt I had given to ChatGPT. So in response to my prompt, ChatGPT has given me this excellent answer. Okay, so since we specifically mentioned that the person is illiterate and he doesn't understand all the complex medical thing, and since he is a farmer, ChatGPT told me like you can compare various aspects of your treatment that that can be compared to that of farming. Okay, so you can it's telling me like we can mention like tell him cancer like a weed that is growing, that has grown in his garden. So we need to do like surgery, right? So and along with the surgery we need to remove the nodes also, right? So based on that we can tell like we will be doing surgery, that is removal of this weed, and in addition to removal of the weed we have to remove the roots also, right? Otherwise the weed will grow back. Just like that, in addition to the surgery we have to remove the nodes. There's something called lymph nodes and that can be removed, right? So we'll get a clear cut idea like why, what in addition to normal surgery, why the lymph node dissection has to be done, right? Just like that we have to advise him like we have to do chemotherapy, right? So that can be ChatGPT is telling like I can explain telling like chemotherapy can be compared to spraying a weed killer. All right, so he can directly understand like the weed, what's the use of a weed killer, and that will be the practical application of chemotherapy, right? So in addition to that, it's also telling me like whenever I'm giving this bad news breaking, I need to include these words in my dialogue. Like you are strong, you have a whole team of doctors and nurses here to support you in every step of the way. We will get through this together, right? So by including such reassuring words, I can confidently break this bad news to the patient, and patient will understand it clearly, and the communication will be excellent, right? Now you will be thinking like, oh, this I'm working in Chennai or I'm working in a state, and I will be talking to this patient in the native language, right? So the interesting thing is all these AI tools are really good with talking about all the Indian languages, okay? And the quality of usage of words, especially say Tamil words or Malayalam words, these words, it actually varies from this AI tool. And among the different AI tools, there is a AI tool by Gemini, by Google, which is called Gemini AI. Okay, and Gemini AI is excellent with Tamil and excellent with all the South Indian languages. So you can give the same prompt to Gemini, and as the last line you need to tell like the explanation or this the dialogue should be in Tamil. Okay, so you can even mention say Tamil that is spoken in Chennai. So I'm sure that just like in Kerala, in different parts of Tamil Nadu, the colloquial slang will be different, right? So you can even mention that part also. So the explanation, instead of giving in this manner, it will be in pure Tamil, written in Tamil letter alphabets itself, and you can just go through that, and inspired by that this thing you can confidently like explain that to the patient. Okay, most of you will be excellent with rapport building and explaining, but there may be scenarios in which you need some extra help, right? In that scenario you can use all this AI tool for getting some ideas for you on how you can break such bad news or explain things to the patient, especially if they are illiterate. Okay, so this will be an interesting application for you. Now comes the scenario in which how you can use AI in patient care. Now this is something which is like it's something in the early stages, but so many AI tools are coming up which will help you in different aspects of patient care, right? Now, just like I mentioned in the beginning, most of the AI tool that is specifically built for patient care, they are highly expensive and will comes in the range, like I mentioned, in the range of 10,000 to 25,000. But there are certain tools which are free to use as well. Okay, so I will introduce you to one such AI tool. So this name is called Glass Health. Okay, so I will do a small demo of Glass Health so that you can see this. I believe that you will be able to see my screen. I just switch to my tab on Glass Health. Okay, and the link of Glass Health goes by glass.health. Okay, so that's a link of Glass Health. And as you see here, it's almost similar to ChatGPT, and here you can ask anything to Glass Health. Okay, it's like a simple chat type of AI tool. But the difference in Glass Health is like Glass Health is powered by all the medicine books, this is specifically for physicians, and all the medicine books that is available to you has been already loaded to Glass Health, including Harrison and Davidson. Then it has also have support from this thing also, our all the common articles and PubMed articles and Scopus articles that is published for specifically for medicine, and it also has access to JAMA also. Okay, so all this will be used for decision making. Now, the interesting part of Glass Health is like they have ready-made templates like this. Okay, so this is one template, like draft a assessment plan. Okay, so say you already had seen a patient, then you have to write a detailed assessment plan for the patient to be included in the case sheet, right? So they had given 2 samples here, so I will select one of the sample. So automatically in the sample, it's like draft an assessment plan for a 67-year-old woman with a history of type 2 diabetes, present with acute onset chest pain, found to a ST segment elevation on EKG and elevated troponin, right? So automatically it went to its, you can specifically see that it has gone through its medical literature. It has also has access to up to date also. So it will go through all these data, and based on that, it's now creating a detailed assessment plan for you. Okay. Now, the interesting part of this assessment plan is even in the free plan, I'm not using the paid plan of Glass Health. This is, it has a free plan and a paid plan, but the free plan is completely free. And interesting part is like even in the free plan, you can customize the template for this assessment plan. I will show you later on how exactly it works. So you can see automatically, I simply gave only the small detail of the patient like this, and instead it gave a detailed write-up like this, and what all things to be done, what is the diagnosis, what is the treatment that is being need to be given, right? And what is the second diagnosis in the patient, what are diagnosis and treatment, risk of heart failure, all those things, the chronic this thing. And in addition to that, you can see it comes with clickable references as well. So all the content will be 100% accurate. Okay. So in addition to assessment plan, there are so many options. Suppose if you want to ask a medical question to the patient, to the AI, that you can do here. Now, the attractive feature of Glass Health is like it is free of hallucination. There is no lies in the answers given by Glass Health. Okay, so you can use this for asking the question. Then suppose if you want to create history and physical notes, say you are admitting the patient, or say in the OP itself, you want to write a detailed history and physical note in the template given by your hospital, you can do the same. Okay, so previously I mentioned like there's a customize option, right? So this time I'll show you how to customize it also. So here you can see there is a menu option on the bottom left area. So you click on the customize option. So you can see this is a global template. So it's a normal, it's a way in which it's template, but this is completely editable here. Okay, and at the bottom you can see there are custom templates for each and every aspect. There is one for DD, how exactly the differential diagnosis answer will come up. Okay, and there is one for history and present illness. So this is the default template. This is completely editable. You can make any change here. Okay, and just like that, for each and everything, for discharge summary, for patient handout, for everything, there is a ready-made template, and there is an option to customize it according to the format that is followed in your hospital. Okay, so I'll give a sample here. So I go for this option. Draft a history and physical note of like these are the things like 65-year-old female, and these are the chief complaints: coughing up, green phlegm, and short of breath. Then these were the clinical findings. These were the vitals, and these are the findings that you obtained in the clinical examination. Like you can see, these are not written like a sentence-wise format. These are simply like as phrases and followed by comma, right? So based on this, and some lab parameters are also there. Okay. Now you might be thinking like it's very difficult to enter this lab data and all, right? But the interesting part of Glass Health is like the Glass Health is attachable to all the hospital softwares. Like you will be having a HMIS in your hospital. So Glass Health is directly integrated, can be integratable into it. And in case you are upgrading to the paid plan, and paid plan is also very cheap. It's not expensive. I will come to the payment later on. So once you get to the paid plan, their team will automatically contact you, and they will through online, they will come to contact with your IT team and automatically integrate into your hospital's computer also. So by that way, it gets access to the lab module of your hospital software, and all these data in the lab will automatically come. When you enter the patient detail, if the patient already has some lab data done in your hospital, this data will automatically appear. Okay, so this is very easy, right? Now, based on the template, it now creates a detailed history and physical examination note, as you can see in our traditional format. History of present illness, past history, surgical history, family history, social history, everything is there. Then what are the findings in the clinical examination findings, right? What are the lab values? What is the clinical impression? What is the diagnosis? Okay, and what are the treatment plan and so on. So you can simply copy this and paste into your most of the hospitals. I'm sure that you will be using a computer in your OP as well as in your IP. So you can simply click on this copy button and paste into your computer, in your hospital software, or if it's already integrated in your computer, it will automatically appear in your hospital software itself. All right. So it will make your life so much easier. Same thing goes with the discharge summary also. Say if there is a patient admitted and you want to create a discharge summary, just like this, you give some data, okay, and automatically it will create a detailed discharge summary. You don't need to type the discharge summary, it will automatically come. All right. Now, coming to the payment part of this thing, the payment of Glass Health is just same to that of the paid plan of ChatGPT. It's around 2,000 rupees per month. Compared to all other AI tools, like I have tried so many AI tools for which are specifically available for clinicians, and compared to others, this is very cheap. Like for most of the others, it will be starting price will be in the range of 8,000 to 12,000, but this is just 2,000, and this is usually affordable. And even hospitals can also consider acquiring this, and they have some team plan or something in which individual package will be lesser, and hospital can pay the amount to Glass Health in case you consider to acquire use this. Okay. And they have also have an interesting option called deep reasoning. Deep reasoning means instead of giving the answer instantly, it will actually think for some time. It's high IQ model. So it actually thinks for a long time and then give the answer. So compared to the free version, the deep reasoning version will be even accurate. But the only catch is like deep reasoning is only available if you go for the paid plan. Okay. In case you don't want their paid plan, it's completely fine. You can always use the free plan, and they have a very generous free plan usage as well. All right. Now they have some benchmarks also, like how the Glass Health has been performed on various aspects. So you can see they have given so many USMLE like questions, and its accuracy is around 89% for the free plan and 97% for the deep reasoning model. Same for JAMA CC and NEGM CPC. I feel like they are the clinical questions, clinical scenarios created by this different set of institutions or organizations, right? So you can see accuracy is under a range of 97 to 98%. So this is highly reliable. Again, you have to do a manual review before adding into the case sheet, but you can definitely use this. So this will save a lot of your time, right? Okay. Now I show one really like very useful feature. Like I know that all of you will be busy clinicians. You will be seeing so many interesting cases on a daily basis. And once in a while, you will be thinking like, oh, this case is really interesting. If I get some extra time, I could have published this like a case report, or at least I can create a case report and present in a conference, right? So in such scenario, you can use AI to aid you with that. Okay. So what you need to do is, you say you have already seen an interesting case. You simply need to take a photo of the discharge summary. Okay, so I'll just show a sample. Now, this is a neonatology case actually. So this is a case of infantile pustular psoriasis. So this was a discharge summary. You simply need to take a photo of any case of any discharge summary. Okay, in case the discharge summary is having multiple pages, that time you can install the all these CAM scanner like apps in the phone, which are free to use. In that case, if there are 3 pages for the discharge summary, you can use this CAM scanner to scan page 1, page 2, page 3, and it will attach all the 3 pages together into a single PDF. Okay, even that will do. And what you need to do is we will use a prompt like this. Okay, prompt, like I mentioned in the beginning, prompt is really crucial, and how you structure the prompts determines what is the quality of the output. Okay, so here what I have done is like I already taken the photo of the discharge summary. Then I created a prompt like this. Now prompt says like write a complete 1,000-word case report. Okay, this 1,000 can be changed to 1,500 or 2,000. It's up to you. Based on the attached discharge summary that is fit to be published in a high impact journal, a Q1 or Q2 journal. include at least 10 references from PubMed, because we will be using certain AI tools which has real access to PubMed. Okay, so it will go through PubMed, look at similar articles, and then write the content for you. Include a 250-word abstract in the beginning. If you are sending it to a journal or sending it to some conference, definitely you need an abstract, right? So we are telling it along with the case report, we need to have a 250-word abstract, and we are also telling like add a catchy title to the case report. Okay, and for like running this prompt instead of ChatGPT, I am going to the AI tool that is released by Elon Musk. Okay, most of you will be familiar with this. The tool is called Grok AI. Okay, Grok is almost similar to ChatGPT and it's free to use. Only difference is like compared to ChatGPT, the amount of hallucination or amount of lying in the content is very, very less in Grok AI. And in addition to that, Grok has real-time access to internet. So suppose if you are mentioning the prompt like go to this website and grab data from there, Grok can actually go there and take the data. ChatGPT will try the same, but most of the time the answer it grabs back may not be 100% accurate. Some issues will be there in the answer, but in Grok it will be accurate. That's why I decided to go for Grok for this particular scenario. All right. So now I went to Grok. Okay, in Grok there is an option called deep search. Okay, deep search is very simple. It's like by default, if you are going to Grok and you are telling Grok, asking Grok regarding any question, like say what are the major complications of this particular disease, it will definitely go to different websites, grab the data, and will give you the information, right? But the thing is like number of websites it refers to before giving the answer will be limited. Okay, it will usually goes for around 15 to 25 websites, right? So to overcome this, Grok, people who developed Grok, they added an extra feature called deep search. Okay, so if you activate the deep search when you ask the question, so instead of relying on top 25 websites, it goes for 50 to 75 websites, so that the answer you obtain will be based on a deeper understanding and it will be more comprehensive as well. Okay, since we are writing a case report here and we want it to be comprehensive with so many references, I went for the deep search option. I activated the deep search option. Okay, and as you can see here, I attached the discharge summary also. Okay, and I gave the prompt that we have just discussed. Okay, and I ran the prompt. So soon after running this, you can see it is now going through various articles in PubMed. Here you can see it's going through different articles. You can see all of these are different articles in PubMed related to infantile pustular psoriasis. Okay, and based on that, it started creating the report. And after a few seconds, which took around approximately 30 to 40 seconds, and I got a detailed answer like this, a detailed write-up like this. And just like I instructed, I got a very nice title: Successful Treatment of Generalized Pustular Psoriasis in a 4-week-old infant with acitretin, a case report. Okay. Now, second part of our prompt was to create a 250-word case report, right? So it created a 250-word abstract. So it created a detailed abstract like this. It was followed by a detailed case presentation based on the discharge summary. So since we already attached the discharge summary, there was no hallucination part. It was exactly based on what exactly we have done in we have written in the discharge summary. But the thing is like, instead of our traditional language used in like traditional style of English used in the discharge summary, this will be using an academic style of writing, right? So after the case presentation, there is a detailed discussion part. Okay. As you can see here, it has done a very detailed discussion. And like we mentioned in the prompt, it actually referred to various articles in PubMed like this Ergin et al., Srivastava et al., and so on. It compared our finding with the case reports and similar articles written by these authors from PubMed. And at the end of the article, you can see all the references with DOA number. Okay, so you can click on this DOA number and you can verify whether these articles are real or not. Most of the time, it will be 100%, it will be there. And you can later on convert this into Vancouver format. Say if you are planning to publish it in certain journals, they might tell you like references should be in Vancouver. So you can use tools like Zotero to convert it into Vancouver format. Right, and you can make some minor modifications also. You can directly send this abstract to various conferences like you will be attending regularly, and you will be able to like make these case presentations also, right? So basically, this AI tool, like whatever time that we took for generating this case report will be very less. Like the only time we took is we took some time to take the photograph. That might be less than 5 minutes for the photograph of the discharge summary, and we copy pasted the prompt And when we ran this, it took maximum, say, 1 minute to create the main report. So within 6 minutes, you got a very detailed case report, which need only minor tweaking, minor editing and here and there, right? So all the interesting cases that you see from now on, you will be able to create some interesting case reports. Okay, so that will be a very nice application for you in your daily clinical practice. Right. Now, in case if there are any like surgeons in the group, or say you are doing certain procedures, those notes also can be converted, like auto-created using AI. So what you need to do is you draft a prompt like this. In case it's a surgical case, you can just draft a prompt and give it to any AI. So the prompt is draft an operative note for an uncomplicated emergency laparoscopic appendectomy performed on. Now the thing that you should ensure is like you should not enter the name of the patient or the original hospital ID. There you can put whatever name you wish, like Jane Doe or whatever name you feel, and like a imaginary MRN number or hospital ID. And the rest of the details you can mention, like what are the procedure that you have done. Like this can be applied for all the medical procedures also. Here for a sample, I just include a surgical procedure. So I'm mentioning like it's a 30-year-old female. Pre-operative diagnosis was acute appendicitis. Procedure involved standard port placement, identification of an inflamed appendix, successful appendicectomy without difficulty, no complication encountered. Post-operative plan includes pain control, diet advancement, and follow-up. Anticipate uncomplicated recovery. Okay, so this is the surgical note in brief, right? So you simply add that surgical note in brief along with this prompt. So instantly, this for this I tried ChatGPT. So you can do this in Gemini or Grok also. So instantly it created a detailed, started creating a detailed operative note. You can see, even though I gave a very a raw type of content to this particular AI tool, it created a structured data out of this MRN number, date of surgery, everything is structured, like name of the surgeon, assistant, anesthesia name, okay, that we can insert it manually, pre-operative diagnosis, post-operative diagnosis indications, followed by what are the procedure details. Okay, so the interesting part is like this AI automatically knows what are the steps of conducting a appendicectomy. It applies for all the procedures as well, all the medical procedures as well. So you simply need to mention to AI like this particular procedures was done. So the entire procedure detail will be automatically inserted, as you can see here. Okay. And what are the findings? So you already mentioned that there were a few findings. So automatically finding was added. I didn't mention any perforation or abscess, so automatically the negative finding was automatically added. I mentioned that there was no complication, so it was given as none. Estimated blood loss, I didn't mention anything, so it went for minimal. And specimen sent for pathology, even though I didn't mention anything regarding specimen, so the specimen detail was automatically added. Then what is the post-operative plan? That also has been added. So the good thing is like you can create in such way and you can copy and add to your hospital software. All right. So that will help you with saving a lot of time. Most probably you will be manually typing all this, or your assistant will be typing all of this. So you can save a lot of time there. Okay. And the same can be done with the Glass Health also. In there is an option to create this post-operative plan or post-procedure plan. You can give the same prompt there. Automatically it will create a detailed note like this. Okay. Now the thing that you should always remember, like in all these AI tools, especially ChatGPT and Grok and Perplexity, by default, whenever you are giving any data to this AI tool, they will not be sharing that data to a third person. Say you are attaching a case sheet, or you are giving more details about yourself, or say you are conducting a study and you want to do a data analysis, you attach the Excel sheet to the AI tool. So AI won't be sharing this to a third party. But the thing is like there's too much competition is now going on between these AI tools. So almost like an AI war. So because of this competition, they will be using the user-fed data to train itself. Like every 2 months, they will be releasing better and better models for all these AI tools. Like this, like I mentioned in the beginning, ChatGPT, like last Saturday, it got a major update. So previous update was maybe like 1.5 months before. Okay, so they will be using the our data for this. So in all the AI tool, there is an option called settings within the profile, and in that there is an option called data control, where there is an option to turn off this feature. Okay, so when you turn off that data used for training purposes, that particular option, if you turn off, then you can safely upload the data to all these AI tools. Then it will be 100% safe. Okay, and in tools like ChatGPT, there is an incognito mode also. Okay, so you know you might be familiar with the incognito mode of Chrome and all browsers, right? So if you search anything in incognito mode, the traces of information in the incognito mode, say like just like Chrome, it won't be saved in your computer, or it won't be saved on the server side. It won't be saved on the ChatGPT side also. Soon after you close the window, that browser window, automatically whatever that is discussed there will automatically disappear. So that's like a extra level of protection. So in case you are attaching a case sheet, there you can initially you definitely should turn off the privacy settings. In addition to that, you need to go for the incognito mode. So obviously your data will be 100%. Like I cannot say 100%, but 99% it will be safe. Okay. So that it will be you can use it bit more freely also. But whenever possible, try to like strike off or say hide the patient information, especially if you are scanning the discharge summary and all. You can definitely like once you take the photo, you can, there's option to blur and all, right? So you can blur those areas in which personal informations are there, and that can be uploaded as well. Okay. Now, yeah. And another cool feature of this AI tool is like, say, most of you will be like, I think I'm coming up to it in detail. Like say surgical notes and all, you might be scribbling with your pen. So all these AI tools are really good with handwriting recognition. Okay. So you can say in the same case, like instead of giving prompt like this, you can simply scribble everything in a piece of paper, take a photo of that, attach the AI tool and give a prompt like draft an operating note for this case. Okay. So it automatically goes through your handwritten note, grabs everything out of this, identifies your handwriting. It actually, I was really surprised, like even with very poor handwriting, like even including myself, our handwriting will be really bad, right? Even then it is able to identify it properly, and based on that, it creates the notes for you. Okay. So that also will come really handy for you. Right. Then, okay, that we covered. So this was a handwritten note that I mentioned. So you can see we will be creating so many handwritten notes like this. Here you can see this is a case of diverticulitis. So here it's a nice handwriting, but sometimes this will be in running letters and so on. Again, it can go through this, and it can like you can give prompt like this, grab all the text from this handwritten note, maintain the formatting and proofread spelling errors. Suppose if you have done very running letters, and in between you will be skipping certain letters and all, right, in certain words. In that case, it will automatically proofread and it will automatically correct the spelling errors. Okay. And you will get a detailed write-up, and it can process that as well in whatever way you want. And say if you want to get exported as a Word file, you simply tell the command telling like at the end of your prompt, like here we will put like maintain the formatting and proofreading, spelling errors, full stop. After that, you put export it as a Word file. So instantly it creates a Word file and give you a link, and on clicking the link, it will instantly download as a Word file. So it's really useful for you. So it can export the content as Word, Excel, PowerPoint, and PDF. So that will be really useful for you, right? Okay. Now comes a scenario where you want to use AI to update your own information, right? You will be using so many tools in this particular scenario. You will be already using UpToDate, right? And sometimes you will be using tools like expensive tools like Clinical Key by Elsevier, right? And sometimes you will go to the library and search certain journals for updating your knowledge, right? So in such scenario, you can use this particular tool. Okay. This is a tool it is highly recommended for getting accurate information in the flash of time. The tool is called Perplexity. Okay. Now just recently you might have come across this name because it became viral in all over India. The interesting part of Perplexity is like this is created as an alternative for ChatGPT, but the difference of Perplexity is like it doesn't have a central memory. Okay. In the beginning of the session, I mentioned like ChatGPT has a central memory. So whenever it tries to recollect data from its central memory, it actually takes the data from wrong places. So errors will be there, or which are called hallucination. How Perplexity works is like it doesn't have a central memory. So whenever you ask something to Perplexity, it actually searches that data in real time in the internet. Goes through all the reliable websites. We can actually have a control over where exactly it searches. Okay, we can decide whether it should search only websites, whether it search only articles, whether it search only social media. That we can decide, and go through all the articles, assimilate all the content from that, and then create a detailed write-up. And in the write-up, there will be detailed references, like clickable references. So I'll just show you. I just searched one national program called Shalabam, which is a newborn screening program. So instantly it went through, you can see it went through some 13, 11 websites as you see here. So based on that, it gives a comprehensive answer of that program. And just next to the these answers, you can see a reference like 3 and 1 here, right? So when I take my mouse over that, this will be clickable. And when I click on that number 3, automatically in a new tab, that particular website will open up. So I can read more and I can ensure that the reference is an accurate one. And we can specifically decide whether it's search only in PubMed and Google Scholar or PubMed and Scopus. And so suppose if you want to know something like some recent some treatment protocol or recent types of side effect of one particular drug, you can go to Perplexity. Okay, and you go for the this globe icon is the area where you decide where exactly it will be searching. Okay, so you go for journal only and you turn off web option, so it only searches in web. Now in search also, in the search part, Perplexity has got 2 types of searches. Okay, it has got a normal search which is free to use, and there's something called pro search. Okay, free search means it searches around 25 sites and give you the data. Pro search means it's 3 times, so it will actually go through 75 websites in detail, and say free search is giving you say 500 to say 1000 word answer. Pro search will give you 3 times. So everything will be 3 times. And a number of free usages of pro is also 3. So every day you can use 3 pro searches. And after that, you can use unlimited number of free searches. Okay. Now, why Perplexity became so viral in India? Because one, this is actually created by an Indian. Okay, so I think his name is Aravind Ramaswamy or something. So he's a resident of US. Now, recently he came across a tie-up with Airtel. So now if you are using an Airtel SIM, so you can go to your phone and you have an Airtel app installed in your phone, right? In that, when you open, there is an option. Now you'll see an option called Perplexity. So when you click on that, this Airtel and Perplexity, they now came up with a tie-up which says like all the Airtel users can use a pro plan of Perplexity completely free for 1 year. So this will be somewhere, it's worth almost 17,000 rupees a year. So you can use this completely free, and you can use this once you activate that, and you create a new Perplexity account using that particular Airtel number. It will have, I'm using an Airtel number. So you can see, in addition to Perplexity, now an icon appeared telling like it's a pro plan. Okay, so I can use Perplexity unlimited for 1 year. So in case you have a Airtel plan, or say your children or your wife is having an Airtel plan, you can make use of that, and you will be also be able to use the pro plan of Perplexity. Okay, and answer is really comprehensive. It's even sometimes it's even better than answers that you obtain from UpToDate, because UpToDate may be referring to certain selected set of articles, but Perplexity is completely dynamic. Depending upon your prompt, it can go very much deeper. And within the prompt also, you can mention like go give more preferences to articles from these certain journals. Say you want to get the data out of JAMA journal, so you can specifically mention that. And so the answer will be so comprehensive. And even in the prompt itself, you can mention the number of words. Say you want a 5,000 word write-up, you can mention that. And initially, you will be able to get such detailed answers. Okay. And at the end of the answer, there's an option called share. So on clicking on that, it will create a very detailed link that you can share with your colleagues in the WhatsApp group, and they don't need a Perplexity account. Directly on clicking the link, they will be able to see the entire discussion. Okay. And now they introduce a new feature called export also. So on clicking the export, you can directly download this particular result, either as a Word file or a PDF file. So that also will come handy to you if you want to save it for future. All right. This I will just click. Okay. Now I'll show an interesting application of how you can create PPT with AI. Okay. This also will come handy to you, as some of you may be working in medical colleges, so you will be taking class on a regular basis, right? Or sometimes you'll be presenting in conferences and you feel like rather than having the traditional PPT, you should have a very, very nicely looking PPT, right? In that case, you can use AI for this, and the tool that we will be using for this is called Gamma. Okay, Gamma is very popular. It's called Gamma AI, and how Gamma functions is interesting. It's like you can give the data to Gamma in the form of multiple ways. Like if you have an already pre-existing PPT with you, that you can load to Gamma. So Gamma will work on that and convert into a very beautiful PPT with AI generated images. Or say you have a PDF with you with all the details, that PDF can be uploaded, or you have created some some data from Word, that Word can be given. Or say if you have you are planning to create a PPT on certain guidelines, and guidelines is given in a particular website, that can be given as a source material. So Gamma people, they created a small video on how exactly Gamma works. So I'll just show you briefly. So here they are loading a Word file on creating future colonies in Mars. Okay, so instantly Gamma went through that content. Original content was in Word file only. So based on that, started creating beautiful PPTs like this with very diverse type of layout and with AI generated images like this. Okay, and in addition to that, Gamma itself has a chat option. Here you can see on the right side, there's a chat option here. So suppose if you want to make any change to certain slides, you simply need to mention that in the chat area. And based on that, it instantly makes the change. So I will just show you. Here they have a slide like this, which is completely blank without any images. So we gave in the prompt like, can you give me a new layout for this card? Okay. So instantly the AI worked on it, and within seconds it created a beautiful layout. It changed it to a beautiful layout, added a nice vibrant image also. Okay. In case you didn't like the image, you want a spaceship there. Again, you go to the AI and tell like, I didn't like this particular image, change it to that of a beautiful spaceship with these colors and also. Instantly it will work on this, create a AI image of a spaceship and add it there instant. Okay. So I'll show you, these are the different ways in which you can load the content. So these are the import options. You can import a PPT, Word file or PDF, or you can directly give the web pages. Okay. Suppose if the topic is really new, you don't have any content with you, then you can go to Perplexity, like we mentioned Perplexity, right? So in Perplexity, you can tell Perplexity like, I have a presentation on this particular topic. I need you to write a 1,500 word write-up on this, something like that. So Perplexity will give you a detailed 1,500 word write-up referring to various websites and journals, and you will get the write-up, right? So within Gamma, there is a special option called paste in text. Okay. In such cases, when you're getting answers from other AI tool, you simply copy that content from that AI tool and click on this option Gamma called paste in text. Okay. There is an option to directly paste this content directly, and Gamma will work on that. And even though the content created by Perplexity in the form of a headings and subheadings and bullet points, it automatically works on this and convert it into beautiful slides. Okay. So that also will come handy to you. Now I'll just show a simple example of a PPT with me. It was on H1N1 influenza. As you can see, the PPT was really bland. There was no images. All the slides were really bad like this. So suppose if I'm taking this class to my undergraduate student, they will start snoring maybe in the first 10 minutes itself, right? So what I had done is like I copied this particular, I just loaded that PPT into Gamma. So Gamma automatically recognized what are the contents in each PPT, each slide. Okay, so first slide was the title, H1N1 influenza. Second was introduction. Third was epidemiology and so on. So now there are some customization options also. Okay, so you can see there is an option called generate, condense, and preserve. Okay, generate means that suppose if you are giving the base content and the amount of text in that content is very low. Say you want to create a 50 slide PPT, but the amount of content that you give to Gamma is very less. Say you are giving only 500 word content. That time you can go for the generate option. Now what will happen is like Gamma will work on this your content, and with its AI knowledge, it automatically expand the content with whatever things that can be added for this topic. Okay, but the thing you should keep in mind is like Gamma can hallucinate. So once it create the slides, you should cross check the content that is given by Gamma, and you need to do some proofreading. Okay, condense option is just the opposite. Say you are giving some content that is really big. Say you are giving 5,000 words one PDF to Gamma and telling it to compress into 30 slide PPT. Okay, that time you load the content and you click on the condense option here. So it will automatically condense it to smaller chunks. Then the last option called preserve means that suppose if you are loading a PPT, you want it to be preserved as such. You don't want to make any changes to that. In that scenario, you can go for the preserve option. Okay. So when you click on the preserve option, whatever content is there in your slides, it will be preserved as such. But it will, instead of making any modification to your existing lines, Gamma will add more images, AI images, change the layout and beautify it. Okay. It won't change your content. It will make a very beautiful slide out of that. All right. Now this is the amount of text per card. Card means slides. Okay. So brief means each slide will have say 2 to 3 lines. Medium means just like this. Each slide will have around 7 sentences. And detailed means it will be elaborate. Say you are taking certain sessions and you are not that prepared. That time you need some extra help from the slides. In that case, you can for the detailed option. Okay. Now the output language is also interesting. Here you can choose whatever language you want. Say you have a PPT already created on H1N1 influenza. You want to take a patient awareness session to people in Chennai. So you want the presentation to be Tamil. That time you can choose the output language as Tamil. Okay. So even though the base information that you're given is in English only, but the final PPT will be in Tamil. So that also will be useful for you. Now this was the H1, you remember the slide, right? So it was completely blank. So instead of that, it created a beautiful slide like this, created a 3D image of an H1N1 influenza virus automatically. Then there was a slide on high-risk groups. It created a beautiful layout for the different high-risk groups, added a golden icon. Now there are a lot of themes in Gamma, and based on the themes, entire things will change. It not only determine your like font colors and this thing, it actually influences the image also. Okay. Present theme that I chose was a theme called Aurum. Aurum is mainly focusing on gold and black. Okay, so you can see everything is in golden pattern. You can see the top of the ICUs having some golden designs. Sometimes you'll see doctors and nurses wearing so many golden ornaments and all. Okay, but you can change later on. And the background will be always black. Okay, so it looks really nice. And there was a very boring slide in my original slide that is on lab investigation. So that was changed into this beautiful slide. So you can see this crowded one was changed into a 3-step process, and they added a very detailed or very realistic image of a lab technician also. Okay, and you can see in Gamma, you can give some addition instruction. So I always give addition instruction like whenever you create image of people, ensure that they are Indians. Okay. Why this matters? Because sometimes since Gamma is created by people in the US, most of the time the images generate will be US people only. So once we take class in our sessions, like in our lecture also or to our doctors, like in such scenario, if you show too many foreign images of foreign nationals, they will feel detached, right? But if they're seeing Indian people within the slides, they feel more attached to the presentation, right? So this will also comes in handy to you. So I always give that extra instruction. Now there was one boring slide on supportive therapy. So that has been changed into this this beautiful manner. You can see these were supported therapy and some extra images has been added. Okay, and say sometimes it creates images which are not realistic. Here you can see there's a patient lying in one ward and one copper plated oxygen cylinder is there, which may not be used regularly. So in case you want to change this image, you simply tell that chat option was, it will be there to the right side. There will mention like change that image to a person lying in a ventilator like that. And you can mention an Indian person or Indian male or Indian female like that. So automatically change to that aspect. Okay. And image type of image also can be like selected, whether it can be photorealistic, whether it can be illustration, whether it can be like animated type drawing, whether it can be Pixar style that you can mention. So automatically the image generated will be in that manner. Okay. Now only catch here is Gamma is not 100% free. It has a free and paid plan. So in case you want to use it regularly, you can consider getting into the paid plan, and paid plan will be in the range of two paid plans are there, 500 per month and 1000 per month. The free plan will be in the range of no, free plan is free. But the one interesting thing that I noticed is Gamma, in case you have a say there are 3 doctors in your department, only one person need to take the paid plan, and you can share the username and password with others. They are not that strict with the IP address and all. Okay, so all 3 of you can share the monthly cost also, so that it will be useful. Okay, right, I'll just shift this. Okay, this is another example of how you can combine Perplexity and Gamma as well. Here you can see I went to Perplexity and I gave a prompt like, I'm a doctor from India. I have a 1-hour class for MBBS students on the topic of monkeypox. Give me a 2000-word detail on this topic. And then I mentioned what are the topics to be covered. Okay. So based on that, Perplexity has given me a detailed write-up like this. So an introduction, epidemiology, you can see the references, clickable references here. And there is transmission mechanics, investigation and all. So I copied the content out of Perplexity, pasted into Gamma like this. This is the area we paste. Okay. So based on that, Gamma instantly created a beautiful PPT like this. You can see again, I gave the same theme only. So it added a beautiful, vibrant image of a monkey in an Amazon forest automatically. Now, there was some section on endemic region. So automatically it added images like this. Now, I was really amazed on one interesting factor. It's like in the initial write-up, everything was regarding Africa. The outbreak, everything was in Africa. So even without telling Gamma to anything regarding that, Gamma automatically identified that. And when it created the AI images, you can see it automatically applied an African theme. Here you can see all the people are African, the huts are in the African shape, continent is that of Africa, care workers are African, and so on. Okay. And there was a section on different outbreaks. So based on that, you can see it created a detailed timeline like this. Okay. And in the background, you can see it created a globe. Again, it highlighted Africa in that. So it's really highly intelligent. Okay. So I really like that part. Now, this is the last part of the session. I just want to show you some fun part also. So that's why I added. So in addition to all these clinical or medical use of AI, you can even use AI for some designing part also. Okay, and you don't need to be a designer or an artist to do that. You simply go to this AI tool. Even ChatGPT is fine. You give, I'll just show you. You go to ChatGPT and you can give a simple prompt like create an anatomically, like say you want to create an image of a human heart. Okay, create an anatomically correct medical illustration of human heart showing all 4 chambers, major valves and connecting arteries and veins, white background. Okay, you can even make it even better also. Now the problem is how you structure you have to imagine how the image should look like, and you should be as descriptive as possible. So based on that, it creates a image like this. Okay, but the thing is, in case you are not that elaborate, like in this case this is not elaborate, so you can see the heart is not 100% accurate. There are so many wrong things in the heart. Okay, so there's a easy way to overcome this. Like every time you can create excellent images, and in case you are creating medical images, the images will be medically accurate as well. So okay, so instead of going to ChatGPT and giving prompt directly like what is to be generated, that image that you need to generate, what you need to do is, a step 1, you tell ChatGPT this particular thing. You tell ChatGPT, like in the beginning, we learned like the person who develops a prompt is called a prompt engineer, right? So we'll tell ChatGPT like ChatGPT should act like a prompt engineer and create a prompt for generating an image of an anatomically accurate human heart. Okay, so we want AI to create the prompt for AI, and in second round, so I'll show you. So I created this. Then I went to ChatGPT. So you can see it created a very detailed prompt like this. So my initial prompt was like 2 sentences. Now it created, based on my first prompt, it created a prompt like create a highly detailed anatomically accurate illustration. So many details of the heart is there. Okay. So my job is I simply copy this prompt. Then I go to ChatGPT and I'll get a highly accurate illustration like this. So I'm using AI itself to create a prompt for AI, and that prompt is loaded to AI to create an image. Okay, so that's the way in which you can create so many beautiful images. So this is not restricted to anatomically images solely. Say if Deepavali is coming up, say you want to create a you know, in WhatsApp groups, we will be sharing so many happy Diwali messages, happy Pongal messages and all, right? So instead of this time, instead of sharing it those forward messages, you can create one for yourself. Okay, you simply go to ChatGPT. So here you will mention like, assume that you are a prompt engineer and create a prompt for a happy Diwali message. Like then you can mention like what all things should be there, like which contains the spirit of Pongal, or all those details you can mention. And suppose if you want your photo also there in the image, you can attach your photo also. Then at the end you will tell like incorporate that attached image in the greeting also. Okay, so based on this, ChatGPT will give you a detailed prompt for creating a beautiful greeting card that can be shared in WhatsApp. Okay, that you copy and run in ChatGPT. So then it will create a beautiful Pongal image which you can download and share in WhatsApp. Okay, so this will be 100% self-made, and people will wonder like how you created, like, especially your head and all will be there in the greeting. So it will looks really nice, and you don't need any technical expertise for you doing this. All right. So these are just a glimpse of what all things AI can do. And later on, when we conduct the session later on, like in next month, that time it will be a hands-on session in which we will be telling you to bring your laptops, and everything will be done. Not only this, there are so many other applications also. So everything will be done doing in a hands-on mode. Like I will be like telling you these are the things to be done. So you'll be trying those in your laptops, and you will be able to learn in a better way. All right. And this is another example of a heart. So you can see how realistic it is. So it will be anatomically accurate as well. Okay. Nowadays they are becoming so smart also. All right. So I saw that there are so many questions in the Zoom chat. So I will go to these questions one by one. Okay. Discharge summary AI tool. Okay. Discharge summary AI tool. It was called Glass Health. Glass.health. So that was the link of the tool. Okay, I think, is there any other doubts? So you can share the doubts in the Zoom chat. So I will answer the doubts.
Yeah,
I should thank Dr.
Sharon
Chandrasekhar for bringing an important new innovation in the field of medicine, that is AI. And I should also thank Dr. Sharon sharing his views on this, how to utilize it for a practical purpose. I think I am just a beginner, not even a beginner. I think Chandru knows me very well, but he is very well versed with all those things. I think we'll have a nice workshop in the cardiometabolic conference also. Thank you, sir. Very nice.
Sure, sir.
Thank you,
Sure,
sir.
sir.
Thank you.
So thank you, Sharon. Like it's a kind of a insightful talk on the artificial intelligence. Like you started with, in fact, I was surprised to see how effectively we can communicate with the patient. You
Yes, sir.
started
Yes,
with
sir.
the patient with cancer and how we can address, counsel them. Like I was a bit amazed by the kind of response given by the chat GPT.
You can get in Tamil also, sir.
Yeah.
That's a
Yeah,
best part.
something analogous to a weed in a garden. Like so, I was, in fact, fascinated by the kind of thing and your passion for AA also. And in fact, like I have listened to, I am in fact a part of many AA group and even member of the some of the groups, the Pan India groups. I mean, so it's kind of you made some difference in the thing, like. Not only the kind of thing, you made it very simple and easy to understand. Some of the useful the free apps like which we can have it for as a ready reckoner, and how we can communicate, how we can document, how we can write our summary notes and those kind of thing. And really like it's the final part of it, like we all would be like to have, because almost a month, like we would be traveling and giving a lot of lectures. So sometimes I didn't have time to do that on traveling. I will be doing all this preparation of these lectures, and I think you made my job also simple by introducing gamma to the kind of thing. Like it's very good lecture. Like I have something to ask. Like of course the thing was discussed. Like the uploading the patient data, you said already said like we need to hide the patient detail for the
Yes, sir. Yes, sir.
kind of thing, like because I see the kind of the initially it was started with some kind of a yeah chat gpt kind of thing, then DeepSeek, like perpetuity copilot, and Gemini. So there are so many things are like, it's like as you rightly said, it's a war. Like so how we can find out that which one is reliable, that is more important, because we would be sharing our most important valuable the patient data sometimes knowingly or unknowingly, and it should not have any kind of repercussion on the doctors. Like how do we know that like it's reliable, like
Sir, it's mainly based on our personal experience, sir. It's like we can try out various tools and see which one is giving the answer based on our requirement. Now, there are certain tools which are highly customized for this purpose. There is a tool called Notebook LM by Google. So this particular tool, it doesn't have any access to internet. It's like this is like an offline thing only. So we can attach the data, and everything it gives will be based only on whatever we have attached. So among them, Notebook LM is highly safe to use. And in ChatGPT also, if you activate those two options, like activate, like deactivating the data training part, and you are activating the incognito mode, that time it's safe. Regarding Gemini, that's which I AI tool by Google. There is no privacy setting. They are telling like they won't be using, but you cannot 100% trust them. So there is that issue is going on now. To address that, now Gemini people, they presently introduce this incognito mode in their beta version. So they are telling like in the coming future we will be able to get that incognito mode also. So everything depends on our personal this thing. And there are certain AI tools like this Glass Health and all, which can be integrated into your hospital software also. So in that case, we don't need to upload the data. It will automatically take the data from the software, and this will be locally hosted. So it will be a bit more safer. So that depending
so
on our preferences, sir.
yeah, there was a question also again the similar kind of thing, the uploading the discharge summary, we may have some ethical issues also, like that we need to hide the patient
Yes,
detail.
sir.
That is,
Always. Yeah, that will be always better.
second thing is like there are see when we go through a kind of thing, reference kind of thing, we would like seeking some recent references or free references. Like most of them we may not be able to access to. That would be a paid one. Like so, of course, definitely these apps will help us to have get into that kind of thing references?
No, sir. Actually, these apps have only access to, suppose if it's a paid journal, they have access only to the abstract of the paid journals. So, but there are, you will be knowing that there are certain like gray hat tools like SkyHub is which will help us to download the data in case we don't have the access. But the problem is with SkyHub is like recently it got an update in which now the last 3 years of articles are not able to be downloaded. It's like now we are only getting articles which are published till I think 2022. So all the recent articles are not there, but there's an alternative website called Anna's Archive. So there you will be able to get even the recent articles in case you want to download them. But now the interesting thing of this AI tool is like we don't need to download the articles like previously. Like whatever the details that we want out of this article, this will be automatically grabbed from this by this AI tool, and that will be automatically assimilated. And there's a alternative for Google Scholar and PubMed, and that alternative is called Consensus AI, which is again free to use. There it has got a filter called free article filter, something in that word. So if you activate that, now what will happen is like, suppose if you give a search term or a research question, whatever results it shows will be 100% free articles. So that you will instantly you will be able to download all the full PDF files. Again, you need to not need to run behind free like paid articles. So you will get adequate number of free articles for each of your queries. So that also comes in handy. So usually in my regular session, I used to cover that in detail. I didn't cover it today because our session was a very small one. That's brief one.
I think the prompting is more important. Like we
Exactly,
need
sir,
the art of prompting. So
Exactly.
that will make us to get the record
this thing.
So that is the thing. I think we need to learn the art of.
Yes, sir.
I think as you said, like the ethical use of AI in healthcare as physicians, are we ready? I think with the help of Sharan, I think we'll be ready.
Yes, sir.
Over to Dr. Vinod.
Vinod is driving our in
Well,
the
I reached, sir. Now I reached.
Good evening. Good evening. Nice.
Good evening,
Nice to see
Vinod.
you, Vinod.
Share your thoughts on this talk.
Yes, sir. It was a very fantastic talk. Second time I'm listening to this, actually. I was a great fan of him. He brings in a lot of new ideas, how it works in both in the clinical and non-clinical sites. So it's really good. So I just want to share my thought on AI. Now we could have, everybody would have read the news on about the TCS laying off about 12,000 mid-range managers across the country. The main thing, initially it was thought like recession kind of thing, but when the head of TCS told, he said, we try to train everybody into AI modality. Last 1 year, the mid-range managers are not able to adapt to the new technology. That's the reason we are removing them. So that could be one among the reasons. So probably we don't wish, in another 10 years, AI is going to be there in the medical field too. So as CMC, like Chandrasekhar sir agreed, we are trying to bring that to you all at the very early stage so that you are all ready for the new AI tools when it becomes mandatory for your use in the hospitals. That is my thought process, sir. Legal aspects are going to be there, probably, and over a period of time, all this will be sorted out, and they will be grabbing the data, because unless they grab the data, they will not be able to be fine-tuned. So whatever data we give, they will be able, they should use it and refine it. So whatever settings we keep, probably the background, the company will be working on the data, whatever we are providing. Otherwise, the fine-tuning will not be possible for the AI. So that's what my thought process is, and it was a wonderful lecture, sir. Thank you, Chandrasekhar sir. Thank you, sir.
That is applicable to all the apps. Like that depends on the feed, like how much of of the feed. So it gets matured like over a period of time. So that is the most important thing. I think we have come to the end of the session, and thank you, Dr. Sharan and Dr. K. Shanmugam and Dr. B. Vinod Kumar, and I thank all the participants also, like who have enthusiastically participated and sparing their valuable time. And in fact, the 1 hour session, it was so absorbing that we only at the end of the session I could notice that it has crossed 1 hour. So it's a kind of such a beautiful insight you have given on artificial intelligence, and we are sure that we'll be seeking your expertise, and educate us, help us to become the techno savvy. Like so, we'd be disturbing you, Dr. Sharan, and
Sure, sir. Sure, sir. Happy to collaborate, sir.
with this, I come to the end of the session. I thank all the participants, and once again, I welcome you all to join us for the fourth edition of the Cardiometabolic Congress, which is going to be held on September 27 and 28 at Hotel Hilton, Chennai. We'll be eagerly waiting to see you all, and thank you. Wish you all a happy learning. Thank you.
Thank you.
Thank you.
So, all a happy Independence Day also.
Yeah, thank you, sir. So nice.
Nice.
Yeah, yes, sir.
Nice.
Happy Independence Day, sir. Thank you, sir.
Yes, yes.
Thank you.
Thanks.
Thank you, sir. Thank you. Yes, sir.